All right, good morning everyone. Good morning on this beautiful Sunday. So can I start off by saying that we have 3 new cases overnight. 2 are overseas acquired in hotel quarantine, and we have 1 new case, and this man is the brother of one of our 2 latest cases. So that's 1 extra community transmission, but once again it's linked, so Dr. Young will talk more about that. Can I really thank Queenslanders for coming out and getting tested? This is fantastic. We really need to keep this up, like I said, over the next 24 to 48 hours. So we have 71 active cases. We've had 11,348 tests in the past 24 hours. But once again, it is absolutely crucial if you are sick to stay home and get that test done. That's absolutely crucial. So any of those symptoms, make sure you get a test. So everyone's doing the right thing at the moment. We're very comfortable with the situation, but Dr. Young will talk a little bit more about this man, and also she'll talk about about the connection to the PA doctor. So I'll leave that to Dr. Young. Thank you.
Thank you very much, Premier. Good morning. So yes, we've had 1 new case overnight, who's a gentleman who's the brother of our first case that we've had in this recent cluster, and we believe he is probably the person responsible for transmitting the infection to that case, and possibly also given the timing to the other case. Now, this gentleman is perfectly well, fully recovered, and was picked up through our contact tracing process. So we tested him. He's PCR negative, so he's not currently infectious. He's fully recovered, but his serology is reactive, and it suggests that he has had the infection and recovered. Now, of course, he could have had that in the past, but it's most likely that he's had it recently and is one of those missing links between the doctor who worked at the PA hospital and this most recent cluster. We won't be able to do genome sequencing on him because he doesn't have any active virus at the moment, but we will continue to test him to see if we can work out what has happened and be able to work through the risks. So at this stage we have these 2 current cases who are both at the Royal Brisbane and Women's Hospital and have both been very cooperative in working with us to go through the many venues they were both at while they were infectious. So I thank both of them for that. And then we have this new case that we'll be talking to work out his contacts. But remember, he was infectious a little while ago. So all of that will be worked through. It is good to see that despite the enormous increase in testing, which I'm very grateful for, we have not had any other cases. It's far too early to relax, because we know that our 2 current cases have been out infectious in the community for the last week, so we would still expect to see cases. It is really important that everyone adhere to the requirements that we ask of them, which is indoor spaces, 1 person per 2 square metres. That's important. Everyone should try and maintain that physical distancing as much as they possibly can, and when they can't, wear a mask. That is also very important. And please, everyone, just go outside. This is the most spectacular weather. This is really important. Enjoy the weather. Be outside, because we know outside is a far lower risk of transmission. Thank you.
Thank you. So good morning everyone, and can I just reiterate, as Dr. Young has said, around what the requirements are at the moment, that everyone understands them and particularly listens closely over the next coming days as we see what happens, to make sure that they're doing everything right. Our officers will be out and about making sure that people do the right thing and that they do abide by the directions that are currently in place. Can I also talk about the reporting that we've seen around the matter involving the young man who tested positive and reporting that there was a party at his place? Can I just say that now we know that that's not the case. Our investigation and inquiries have revealed that whilst there was some initial reporting around concerns that there was a party being held with 25 persons at that residence, and of course we reacted that in a very cautious and quick manner to make sure that we could contact trace. The contact tracing and inquiries that we've conducted after that reveals that in fact there were only 5 other persons there. They've all been accounted for, and the important thing is that they have now been tracked down, contact traced and placed into quarantine. But I do ask that we can tone down some of the language that's being directed against that young man. I don't think that's particularly helpful for anyone. At this stage, our investigation is not disclosing any evidence of any offences having been committed by anyone, but we'll continue to look at it. Thank you. Sure. Look, I don't have the date right in front of me at the moment, but I think the date is not in question. The issue was around the numbers of persons that were involved, and initial indications were that there were more than we thought, but our contact tracing inquiries have actually established, in fact, there were only 5 others. I wouldn't call it, I think calling it a party is really inflammatory in some ways and creates an impression that's not quite right. There were people present there, a number of which were quite entitled to be there. Do you say that you have 5 of your housemates there or 4 of your housemates there that you're having a party or gathering? I don't think so. So I think we need to just be very careful in language. Our indications at this moment, there is no offences, evidence of any offences, but we're still considering it. Well, look, and that's the exact point I'm trying to make, is that we need to make sure that we clarify that the point for this is at the time that he's infectious, that we're concerned about, we're talking about was a group of 5 people other than involved. Now, whether there's confusion over an early event or whether there's confusion over what he said or others have said, I don't think that's quite important at the moment. What we need to do is, as we've done, is establish the facts, and we've done the work to be able to do that. This is what happens every time we run these things out with health and the police to establish exactly what's occurred. We now know that the 5 people that we needed to identify other than he have been identified, and that, I'm trying to set the record right to say, please stop reporting that it was a party of 25 people going on, because it's not the case.
All 5, is he included in that 5 number?
No, it's 5, him plus 5 others.
And do they all live in the house, those other 5?
Most of them, yeah. My understanding is that it was concurrent, so there was testing going on around the same time, yes.
So how many people lived in the house and how many...
Look, I'm not going to get into all the details of this. As I said, we're still running out inquiries around this, and we will establish a full story. We'll come back and talk about that later. At this stage, I'm saying to you that the matter is subject to further inquiries. We're not seeing any evidence of any offences being committed. I think I just said I'm not going to get into the details any further. I think we've covered this enough. The important issue is that any persons that have been out and about and have been in these same places that we've identified through health and has been put on the health website, people need to understand what they should do. The people that we were concerned about that have contact with this young man have been identified. That's the important issue.
And are they, the initial alert said that they've been placed into quarantine? What's happened with them?
Everyone's been cooperative. The people that we're dealing with that we've been able to identify, there's been no issues with them. We're always involved in the process when health requires us to. It's a joint approach between the 2 departments. Yeah. Look, if you want me to articulate the restrictions, can I get my phone friend, get Jeanette to come back and talk to them? Look, what we're saying is that we will make sure that people are doing that. Our officers are briefed every day as to what the current restrictions are and what they expect of them. So it might be useful for Dr. Young to talk to that. All of the directions that are given under the Chief Health Officer's directions or any other directions that are lawful can carry penalties. It's very important that people understand that. But look, we have been, since the start of COVID in this state, we have been in an approach where we have communication and compassion foremost before we go to the compliance approach. And by and large, our community has been brilliant, and they'll be brilliant again. There's always going to be times when people get it wrong. We'll work with them to work out what's gone wrong and take the appropriate action. Thank you. I've got no indications that there's been any problems with him once we work through what actually happened. Thank you.
Thank you. So I just want to remind people that we are updating the Queensland COVID website regularly, so please check for the sites and the times to see if you have been to any of these venues and need to go and get tested and isolate. We have increased the number of sites that are now recommended that they go into quarantine for 14 days. So we said yesterday that the Mama's Italian restaurant at Redcliffe was the high-risk site that people were being asked to quarantine for 14 days. There's now a number of other sites that have been added to that list. So it's not just getting tested and waiting for a negative result, but actually quarantining for 14 days. So I ask people to have a look at those sites. There's a number of breweries, the Eaton's Hill Hotel. We do want people looking at those sites, seeing if they were there at those times on those days, getting themselves tested and either quarantining or waiting for their results, depending on the advice on the website. Can I thank the many businesses? We've had 10,408 businesses that have registered and been approved for the Check-in Queensland app. We've had 2.7 million people, or 2.7 million check-ins of that app since we introduced it only a few weeks ago. So that's great news, but there's still lots of businesses out there not using this app. This app does allow us to trace far quicker and get the factual, correct information that we need. So I encourage businesses, especially leading into the Easter period, to please consider registering for the Check-in Queensland app. And of course, customers can be asking cafes and restaurants and hotels when they go in, have you got the Queensland app? And we'd like to use it, especially if you've got the app on your phone, and encourage those businesses to download it. This will help us track far quicker and identify people who need to be tested and quarantined. I can also advise from the 77 close contacts identified so far at Mama's Italian restaurant, we have 14 results back and they're all negative, which is a really good result. So thank you for everyone coming forward. We'll continue to monitor. We had some long lines yesterday and we're continuing to look at the need to increase staffing and whether we need additional testing sites. Again, people can look at the COVID site, see what private clinics would be open. The Commonwealth has approved their clinics not needing GP referrals, their testing centres, and of course we have our public testing clinics. So if there's really long lines at the one closest to you, have a look around, and it might be sensible to go to one of the other sites so you're not waiting as longer.
Sorry, Mr. Could I ask you a question? Your release yesterday says, and I will quote this, the Strathpine man hosted a gathering of around 25 people at his home between being instructed to isolate and getting positive test results. How could Queensland Health get that so wrong if this man A, didn't hold a party?
So that is the information that I was briefed on at the time, and I understand that the health officials who originally spoke to this gentleman, they say that that's what they understood he had told them. I understand that as time has gone on and overnight there's been further investigation, independent investigation from what the gentleman had said, whether it was a misunderstanding at the time or what it was, I can't tell you, but that was what the health officials who originally spoke to this gentleman, when they first picked him up, that was what they understood had been said, and that had to be acted on quickly. And the police have independently investigated, and of course the gentleman has been cooperative with all of the contact tracing, and it's been clarified that the people that were there are predominantly residents, housemates, who the housemates have been put into hotel quarantine. I can confirm that. And look, I ask people to be very careful in, abusing and, threatening people online. We've seen it with some of the businesses. We don't need to treat individuals like this. It was important information that we put out based on the facts we had at the time, because if we hadn't and that had gone out in some other way, then we wouldn't be transparent about what we knew. We were told at the time there was 25 people that attended the residence. We needed to investigate, track those 25 people down and get them into quarantine. What we've identified through the investigation, what police have found and health have found, is thankfully it wasn't 25 people. It was housemates and I believe one other individual, and they're checking whether that other individual was in any breach or whether they went in and had any contact with this individual or not. So that's a great outcome. But we did put out the information that we believe was factual at the time, so the public were aware. We do remind anyone who is given, who has undertaken a test, that when you go home, you isolate yourself. That isolation should happen, not just not letting people into your home, but also isolating yourself from everyone else in that household as well. So please make sure you are isolating yourself until you get those test results, because it just reduces the risk of transmission.
Are you worried about what impact this could have on the confidence people have in information put out by Queensland Health and
Look,
the other health authorities?
this is not unique to Queensland. We've seen this happen in a number of cases around the country where health officials have had to act based on the health advice they're given at the time, at that point in time, whether they're told that someone worked somewhere or went somewhere, and then that information changes as it evolves over the investigation. But we have prided ourselves from day one to be transparent with the people of Queensland about what information we had at the time. And
When did you realise?
I became aware of this morning.
The release said 25 people were placed into quarantine while the risk was being assessed. If there weren't 25 people there, who was placed into quarantine?
So that's what I was advised of at the time, and what I have been informed of this morning is that there is the housemates have been put into hotel quarantine.
We've got all this information based on what Queensland Health has given us, so that's where the ridiculing is coming from for this people. This is the fact that we think that we've got distracted.
Absolutely.
Would you like to apologise for that, Nick, in that regard?
Oh, look, can I say this, that it is extremely unfortunate that what has been discovered over the last 24 hours, that it wasn't 25 people, but as I understand it, this is the information that was received from this gentleman himself. This is the information that was received by this gentleman himself when he was first picked up by the health officials. Now, whether the health officials misunderstood what he said, I wasn't there, I didn't hear the conversation, but this is the information that they believe that he had provided them at the time, and they've acted on it. Now, it's since, the question that was asked earlier about this potentially relates to a party 2 weeks ago. I haven't heard that either, but I think that can show that the information that people are initially imparting to our health officials, and then what clarification occurs after that, there can be some changes along that way. So I am very pleased that the information has shown that we don't have 25 people that are out there, were in the community potentially at risk, that the numbers are far lower and it's contained to predominantly the housemates. That's a good outcome. Much better outcome than what we thought was occurring yesterday. But it is disappointing that we've ended up in the situation we are, but we also have to act on the information that we have at the time, and that's what health did, and that's what the police did.
Confirm that we've got the numbers right. The 2 infected men are in the Royal. 4 housemates who were there for that gathering are in quarantine, and there's one other person who was also there who wasn't a housemate.
I believe so. So I believe there's so one of the housemates doesn't live there permanently, but we've classed them as a housemate, and they're in hotel quarantine. I believe there's one other individual who attended the house, but health are just investigating and police are investigating at the moment whether that person actually entered the home or whether they had any contact with the positive person. And so as such, they might not need to quarantine, but that investigation's going on.
And the other 4 were all housemates.
Housemates or people who had been staying there for a number of days, yes.
In January, we locked down for less. What's changed now?
Okay, well, I'll pass over to the Chief Health Officer to just talk about her advice on that. Thank you.
Thank you, Minister. Yes, the reason we locked down was because that was the very, very first case of B117, this very contagious variant in the country, and we just didn't quite understand it and know what we needed to do. So that's why I recommended that we needed to, while we worked out what was going, lock down. This time, we've been dealing with this virus now for a long time, and we've been dealing with these variants. So I think we've got a little bit more time that we can work out what's going on. But it is really, really important that people take all those precautions. So I do think it's important that people start wearing masks in indoor environments, and I've been recommending that for the last few days. It's important that people adhere to all of the current restrictions that have been in now for months, in fact the last year. So 1 person per 2 square metres in indoor and hospitality venues. That if people are sick, that they immediately come forward and get tested, and people are doing that, and they're doing it extremely well, and we need to continue doing that. So we need to do all of those things. If those things don't work, then of course we'll have to look at what else we need to do. But at this stage, that's what people need to do. Just adhere to all the advice that has been provided over the last year. Mainly, get tested if you're sick. Maintain physical distancing where you can't. Put a mask on. And if we can do those things, then we might be able to prevent a lockdown.
You still can't rule out a lockdown though at the moment?
No, of course I can't. I mean, this is a virus. It just spreads. We don't always know how. We don't know how it spread from that case that we had in the hotel and how it spread to that doctor, and we don't know how it spread from that doctor to these 3 cases. So, no, I can't rule out anything, but I'm very hopeful that if we do our bit, which is come forward and get tested when you're sick, as our first case did of this recent cluster, he came forward. Well, I'm sure he was thinking, oh, this can't possibly be COVID. He came forward and tested positive. So we just need people to not make any assumptions. If you've got any symptoms, just come forward and get tested, particularly if you've been to any of those venues that are up on the website, or you live in Brisbane or the Moreton Bay Regional Council. It is even more important than ever to come forward and get tested.
The confirmation of this missing link case who's now recovered, did you find out that he had been to one of the venues that the doctor had attended?
No. So we're doing that as we speak. So the contact tracers are talking to him to try and work out if there's been any crossover or whether that means there's another case that spread it from the doctor from the PA hospital to this new case we're aware of. Remembering we won't have absolute proof about this new case because he doesn't have any virus that we can sequence, but it's highly likely. I mean, the coincidences are so strong that he's the brother of one of these cases.
Are all frontline workers in that 1A category being vaccinated now? Because this perhaps could have been avoided if that doctor at the PA had been vaccinated.
It could have been if this had happened maybe 2 months later, because you've got to remember 1 vaccine dose doesn't protect you. You need the second, and then you need another week after that. And we've seen that as recently as New Zealand, where they had someone who'd been vaccinated and was almost due for their second dose, and they got infected and passed it on. So we need a little bit more time. So that's why this next month or so is absolutely crucial. We can't release our guard against the virus. We really have to maintain everything because it would be so awful if we ended up with an outbreak just as we've got the vaccine rolling out. So we need a bit longer before the vaccine will be rolled out. The vast majority of those 1As have received the vaccine, yes, but most of them have only had 1 dose. We're starting on the 2nd round at the moment. Oh yes, the 2 new cases that had virus that they were shedding that we could test, yes, have that B117 variant. It's just that the new case that I've announced today, it's unlikely we're going to be able to get virus from that case because they're fully recovered.
And just to clarify, he's tested positive for COVID-19, but he's no longer contagious.
No, he hasn't tested positive. His serology is reactive. Now, serology is not 100%. The PCR test we do is far more sensitive. Serology is very suggestive that he's fully recovered from COVID. Very, very suggestive, and he is the brother of that first case. So that's why I think he's probably a missing link.
Just to confirm as well, how many close contacts of these latest cases are awaiting results?
I don't have the full number. That's what we're all going through at the moment. We're getting more close contacts every single day because of the venues that people have been to, and then we're going to those venues and getting more information. So I don't have those full numbers at this stage. They're just rapidly escalating.
Do you plan to release a list of locations for this latest one today, the one that serology is tested?
Well, probably not, depending when he was there, because he's now fully recovered. So there's no need to, list those locations because he may or may not have been infectious in those locations. So we just have to work through all that information. If he's been in a location and infectious, then of course we'll release it.
And in regards to masks, we saw the Broncos last night. Not a lot of people wearing masks, obviously, in the open areas.
Yeah.
In the closer quarters, they weren't necessarily doing it. Are you looking to move towards mandatory mask wearing in close quarters?
Well, at this stage, I'm strongly, strongly recommending it, and I hope that people take it off, so we don't need to mandate it. And people in the main are extremely sensible. So it's a really important message that if you're indoors and you can't socially distance, then it's a very good idea to put a mask on.
Did the brother live in a separate household?
Yes.
With it? And
Yes.
where's he from? Is he from Brisbane?
Yes. Yes.
Just on a separate issue of hospital ramping, is hospital bypassing being used to solve ramping issues in hospital overcrowding?
Well, I'm not aware of hospital bypassing happening, but of course when there is, whether any hospital goes into a COGELO, whether there is ambulances delayed at hospitals, those hospitals across the HHSs all share that information. So there are regular discussions, I understand daily discussions about pressures on hospitals across the system so that they can support each other. So just as we had to do recently when we had to stop visitors to the PA hospital, we redirected and worked with the hospitals nearby. So that happens all the time, and redirections so that if a particular hospital has a significant surge happening, that ambulances can be redirected to other emergency departments that don't have as big a pressure. So that's a normal practice, as I understand. The QAS, with their call centre, always monitors every single hospital, how many ambulances are not just there, but how many are on their way, and actually sending the ambulances to the hospital that's best suited to be able to deal with those pressures. No, it's actually making sure that you're sending the ambulance to the hospital and the emergency department that can deal with them most appropriately in the time that's needed. That is a practice that has always happened. It's not bypassing, it's simply making sure that the ambulances are being sent to the hospitals where people can get the quickest and the best care.
Premier, do you think more should be done to fact-check the information that's been put out by Queensland?
Look, I'll just quickly answer that one. Queensland Health have always provided the most up-to-date information that they get to hand, and in this case that was the information that they got to hand, and further investigations confirmed what the reality was. So let's look at the history of how health has dealt with COVID. They have been first class over the last year, and this unfortunately was the information that was presented to them at the time. Okay? Thank you.